Welcome to the third section of our course, where we shift our focus to outpatient procedural coding using CPT and HCPCS Level II classification systems. In this lesson, you will learn how to translate physician services, minor surgeries, and medical supplies into standardized codes for accurate billing. This topic is critically important because outpatient care makes up the vast majority of healthcare visits. And mastering these code sets is essential for any coding professional. I am excited to guide you through the structure and rules of these specific manuals so you can confidently assign codes for clinics, ambulatory surgery centers, and emergency departments. Prepare to expand your coding knowledge, as this section will directly prepare you for the heavy emphasis on outpatient scenarios found on your. As we move from the inpatient hospital setting to the outpatient environment, the codebooks we use change entirely. While we used ICD-10 for inpatient surgeries, outpatient procedures and physician services require the current procedural terminology, commonly known as CAPTAIN. It is vital to understand that CAPTAIN is used to report what the doctor or healthcare provider actually did during the patient encounter. Whether the doctor performed a routine physical exam, stitched a laceration, or interpreted a chest X-ray. CPT is the system you will use to capture that exact professional service. The CPT code set is created, maintained, and copyrighted by the American Medical Association, which updates the manual every single year. Because medicine is constantly advancing, new procedures are added, outdated ones are deleted, and existing descriptions are revised annually to reflect modern clinical practice. As a coder, you must always use the most current version of the CAPTAIN manual for the year the patient received the service. The exam will heavily test your ability to navigate the different sections and guidelines found within this constantly evolving book. The main body of the CAPTAIN manual is made up of Category I codes, which are 5-digit numeric codes used to report the most widely performed medical services. Category I is divided into 6 major sections: evaluation and management, anesthesia, surgery, radiology, pathology and laboratory, and medicine. Knowing how these 6 sections are organized is your roadmap for navigating the book. Whenever you look up a procedure in the alphabetic index at the back of the manual, it will point you to a specific numeric range within one of these 6 sections. One of the most frequently used areas of the manual is the evaluation and management section, commonly referred to as E&M coding. E&M codes represent the cognitive work a provider does when examining a patient, taking their medical history, and making medical decisions. To select the correct E&M code, you must determine the place of service, whether the patient is new or established, and the complexity of the medical decision-making involved. Mastering E&M coding takes time, but it is an absolute requirement for passing the exam and working in a physician clinic. The surgery section is the largest part of the CAPTAIN manual and is organized systematically by the human body systems, from the skin down to the nervous system. A crucial concept within this section is the global surgical package. When a surgeon performs a procedure, the CPT code includes not only the surgery itself, but also the routine care provided immediately before and after the operation. This means you do not code the follow-up visits separately if they fall within the designated global period. as they are already bundled into the main surgery code payment. Sometimes a procedure is performed slightly differently than the strict CPT description implies. Which brings us to the use of modifiers. CPT modifiers are two-digit numbers appended to the end of the main CPT code to provide additional information without changing the core definition of the service. For example, if a surgeon removes cysts from both the left and right arms during the same session, you would add a specific bilateral modifier to show the procedure was performed on both sides. Using the correct modifiers is critical for ensuring fair reimbursement and avoiding claims being denied as duplicates. Beyond the main Category I codes, the CPT manual also contains Category II codes. Category II codes are alphanumeric, meaning they consist of 4 numbers followed by the letter F, and they are entirely optional. These codes are not used to bill for money, but rather to track performance measurements and clinical outcomes, such as whether a provider documented a patient's body mass index or counseled them to quit smoking. While they do not generate direct revenue, insurance companies often use Category II codes to evaluate the quality of care a clinic provides. You will also encounter Category III codes, which are temporary codes used for emerging medical technologies, cutting-edge services, and experimental procedures. These codes consist of 4 numbers followed by the letter T, unlike Category I codes, which require widespread national use and FDA approval before they are created. Category III codes allow data to be collected on new procedures right away to see if they are effective. If a Category III code becomes widely accepted over time, it may eventually be converted into a permanent Category I code. While CPT covers the services a provider performs, we need a different system to code for the supplies and equipment used, which introduces the Healthcare Common Procedure Coding System, or HCPCS. HCPCS is divided into 2 distinct levels. Level 1 is simply the captain code set we just discussed. Level 2, often just called HCPCS, is a separate manual used to report medical products, supplies, and non-physician services that are not found in the Captain Book. HCPCS Level II codes are heavily used for things like durable medical equipment, which includes items like wheelchairs, hospital beds, and oxygen tanks. It also covers ambulance transport services, prosthetics, orthotics, and medications that are injected directly into the patient rather than taken orally. If a patient comes to a clinic, the doctor's visit is billed using a CPT code, but the crutches the patient takes home are billed using HCPCS Level II code. Structurally, HCPCS Level II codes look very different from Captain codes, making them easy to identify. Every HCPCS Level II code is 5 characters long, beginning with a single capital letter followed by 4 numbers. The starting letter broadly indicates the type of item or service being reported. For example, codes starting with the letter J are used for injectable drugs, while codes starting with the letter E are used for durable medical equipment. Unlike CPT, which is governed by the American Medical Association, the HCPCS Level II code set is maintained by the Centers for Medicare and Medicaid Services, known as CMS. Because new medical devices and drugs enter the market constantly, CMS updates the HCPCS Level II manual continuously throughout the year, far more frequently than the annual CPT updates. For your exam, you must remember which organization is responsible for creating and updating each specific coding system. Just like Captain, HCPCS Level II also utilizes modifiers to add specific details to a claim. However, HCPCS modifiers are alphanumeric, consisting of 2 letters or a letter and a number. These modifiers are incredibly specific and are often used to identify anatomical locations, such as indicating exactly which eyelid, finger, or toe was treated. You can actually use HCPCS modifiers on Captain codes and Captain modifiers on HCPCS codes, depending on what the specific insurance payer requires for a clean claim. To summarize how these systems work together on a single medical claim, think of a simple formula. The ICD-10CM diagnosis code tells the insurance company why the provider saw the patient. The CPT code tells the insurance company what the provider actually did during the visit. Finally, the HCPCS Level II code tells the insurance company what specific supplies or drugs the provider used. Together, these 3 code sets tell the complete clinical and financial story of the patient. Because these codes directly determine how much money a facility makes, Medicare created a strict set of rules called the National Correct Coding Initiative, or NCCI. The NCCI contains millions of automated edits that tell computers which CPT and HCPCS codes cannot logically be billed together on the same day for the same patient. These edits are designed to prevent facilities from improperly unbundling procedures to get paid more than they deserve. Unbundling is a serious compliance violation where a coder assigns multiple separate codes for the individual parts of a procedure when a single comprehensive code already exists that covers the entire process. For example, if a single code exists for a comprehensive metabolic blood panel, you cannot unbundle it and charge separately for the individual calcium, potassium, and sodium tests. NCCI edits will automatically catch this error, deny the individual codes, and flag the facility for potentially abusive billing practices. Another major concept NCCI aims to prevent is UP coding. Upcoding occurs when a coder intentionally or accidentally assigns a code that represents a higher, more complex, or more expensive service than what the medical documentation actually supports. For example, coding a Level 5 emergency room visit when the patient only had a minor paper cut is a severe form of UP coding. Your exam will heavily test your ability to recognize unbundling and UP coding to ensure you understand ethical billing boundaries. When preparing for this portion of the exam, focus on understanding the guidelines at the beginning of each major CPT section, as they often contain exceptions to standard rules. Make sure you practice looking up procedures in the index first and then verifying them in the tabular section. Just like you do with diagnosis coding. Get comfortable flipping between the CPT and HCPCS books, because many real-world exam questions will require you to assign codes from both manuals for a single medical scenario. Congratulations on completing the 3rd section of this comprehensive course. You have now mastered the basic structure, rules, and fundamental differences between the CPT and HCPCS Level II coding systems. I highly recommend that you complete the attached practice test for this section before moving forward. Engaging with practice questions significantly improves your long-term retention and solidifies the concepts you just learned. The practice test is included right here with this lesson to ensure you are fully prepared. Keep up this excellent active learning momentum. And I will seamlessly see you in the next section where we will explore reimbursement methodologies and payment systems.